Hi, I'm Jamie Hansen, and today I have a special guest, Colonel Colleen Cooper, who is the G-8 from MEDCOM, as well as the 70 Charlie consultant. Thank you, ma'am, for joining us for ASMC's 75th Jubilee.
Oh, it's my pleasure. Thanks for inviting me.
Yes, ma'am. So, 70 Charlie program is your AOC, or Area of Concentration, in which you train your comptrollers. Could you tell us a little bit about that program?
Of course. So the main way that we recruit comptrollers is through our AOC designation board or through our long-term health education and training programs. Either way that you become a 70 Charlie, it is a mandatory requirement to go through a year-long internship that is required through the DAPAM 600-4. So it's a year-long academic didactic year. We have an intern coordinator that runs the program with our preceptors. Each preceptor has several interns that work for them at one of our major medical centers so that the interns will have access to a lot of different areas within the healthcare field to learn during their internship and to get some experience with, as well as areas geography-wise that have a lot of civilian healthcare in the area as well, because we like to give them a well-rounded education. So the interns can go through several different LFET programs. We have a School of Choice program where they can get a master's in accountancy, a master's in statistics or research methods, or an MBA through their School of Choice that's accredited. And then we also have slots in the Army Baylor program where you get a master's in healthcare administration and a master's in business administration. And then we have our Syracuse program where you get a MBA and an MPH, or MPA, I'm sorry, through the Syracuse program. We also have through George Washington University or Harvard University, we have a legislative affairs master's program through them. So either going straight into the internship or through the master's program and then having the internship at the tail end of their master's experience, they get assigned to a preceptor and then our interns go through this internship for an entire year. And at the end of the year, they sit before a comprehensive oral board with 5 or 6 of our senior 06 70 Charlies that basically test their knowledge comprehensively on fiscal law, healthcare operations, through the major categories that we expect them to have some expertise in, at least on the academic sense, through their internship. And through that board process, they can either pass, get recycled, meaning that they need to focus maybe on some pieces of the education that they missed or need to refresh on, and then they'll come back to the oral board, or they may potentially fail. We don't always have failures in our internship, but sometimes we do. And I think that's our really important internal control at the end of our internship to make sure that the interns have learned everything that they need to know to go to their first assignment as a comptroller and be successful, especially with fiscal law. Because if you show up at your first comptroller assignment, you really need to, it's important that you be able to talk your commander through fiscal law decisions more so than anything else. So we really heavily focus on fiscal law in the oral board. So I think that's what sets us aside as an AOC on the Army side from some of the other services where they don't have as long of a formal training program for their comptrollers. And in fact, actually in the Air Force, they are healthcare administrators in general and could be in a pad job one day, the next time would be in a logistics job, and then the next time would be in a resource management job. So in the Army, at least, we focus our 70 Charlies, they specialize specifically in resource management as a 70 Charlie.
So for our viewers out there, LFET stands for what again, ma'am?
Long-term health education and training.
So that's a very formalized process in which individuals then earn a degree, and then they go straight into the internships, and then they have to pass, like she stated. With that in mind, the strength of the 70 Charlie program, I know the many types of assignments are very diverse. And can you maybe talk about some of those assignments?
Sure. I think there's a lot of different areas for comptrollers to specialize in, or to stay kind of in the general realm of comptrollership. Sometimes people get a taste or a job with a certain appropriation and really like to stay in that appropriation because they really enjoyed working in, say, RDT&E appropriations, or they really enjoy working in MTF, military treatment facility operations, on the healthcare side. So, but there's also opportunities to move around within appropriations and get experience in multiple different appropriations. We also have people that work on the authorizers and appropriators side with Congress. So we have the congressional affairs operations people that specialize in that as well. And we also have people that kind of specialize in data analysis, research methods, formulating models on how to distribute funding, how to calculate efficiency and productivity within our healthcare operations setting. And then some people that like to specialize more on budget execution and fiscal law kind of concerns. So we also have a lot of people that become subject matter experts in resource management and do very well in competing for command positions or deputy commander for administration positions. We compete well because being a resource manager, your tentacles really touch a lot of operations inside an MTF. So you really have to have some level of understanding of all those different areas in the hospital, which ends up making us good deputy commanders for administration and good hospital or MTF commanders, and also MTO commanders as well. We have a lot of leadership experience on the resource management side. So we've had some very successful commanders too.
Oh, that's pretty interesting. Very diverse fields that individuals can work in and leadership positions that they can take. With that said in mind, do you belong to ASMC? And
I do.
Do you think it's beneficial for these junior comptrollers and individuals that work in the FM community to be able to belong with?
I have been a member of ASMC since I became a comptroller back in 2007, I think is when I first joined. And I'll tell you, as a 70 Charlie, we are healthcare comptrollers. So a lot of our jobs revolve around either MTO or TDA healthcare comptroller work. Where ASMC has really benefited me is on the networking side to get to know the Army comptrollers and Air Force comptrollers and Navy comptrollers, kind of get outside of the bubble of the healthcare comptroller world and see how other people are doing comptrollership and learn from them as well. So it has really helped me with networking outside of my specific AOC.
Wow. That's great, ma'am. And I appreciate your feedback on maybe talking about maybe some of your roles that you have played in leadership, and tell us a little bit about yourself.
Oh, okay. So I came into the Army as a Medical Service Corps officer and a 70 Bravo. I did some time early in my career at an MTF. And I did an aide-de-camp job, and I worked in operations and training. So for many years after that, they stopped sending lieutenants to hospitals, and they were sending them straight to MTO units. And I did some field time after my MTF experience, but during that initial formative time as a lieutenant, I got to see what the healthcare comptroller's role was in helping lead the business of healthcare management. As an aide-de-camp for the commander at the time, I really saw the influence that the comptroller had on that commander. Things as a second lieutenant, I generally probably never would have seen had I not been in that particular role. So I was introduced to comptrollership much younger than some 70 Bravos, because most 70 Bravos will spend a lot of time on the operational side in their formative years as a platoon leader, maybe an XO, and then a company commander. So I was introduced to it earlier than some. After I left the MTF, I did some time on the operational side, company commander, XO, that sort of thing at Fort Bragg. And then I applied for the Army Baylor program and did the dual MBA, MHA program through Baylor University, Army Baylor. And then my first Comptroller assignment was in Korea, and I was dual-hatted as the MEDAC Korea and 65th Med Brigade Resource Manager. It was a great opportunity, and I still sell that assignment in Korea to this day because it's the only job that we have in our inventory where you can certify the accounts for a medical brigade and for a MEDAC at the same time. And you really get a lot of good experience in both appropriations in the exact same assignment. So I did that assignment, and then I applied for a Deputy Commander for Administration position. I went to Fox Army Health Center, and I had the opportunity to be a DCA there at Redstone Arsenal. So that was a really great experience for me as a major. And then I came to the headquarters. I was the Chief of Budget Integration. And that was during 2013-14, and I guess my claim to fame during that time was when we started IRIS. That was the very first year that we implemented IRIS, and we formulated the first budget plan for distributing the primary care service line. So, and that was the first year that we put out the statement of operations. So that was my time at the headquarters as kind of a mid-grade major, and then I went to Brooke Army Medical Center, and I got to run the account at the flagship at BAMC, and that was a great experience for me, working in that enormous organization with all the healthcare and the trauma training program that is there. It's only level 1 DoD trauma program we have in the entire inventory. So that was a really great experience. From there, I went over to Regional Health Command Central and was the G-8 at Regional Health Command Central. And then I was afforded the opportunity to go to Germany, and I was a clinic commander at the Vilseck Army Health Clinic in Germany. And then from there, came back to be the Deputy G-8 and Chief of Budget at MEDCOM headquarters. And then I took over as the G-8 about a year ago. So then at a lot of different levels of resource management, and had some great opportunities to go outside the box and do command and DCA position. So really great opportunities. I've been very lucky in my career.
Yes, ma'am. Just real quick, so for the viewers out there, you mentioned two acronyms. One's called IRIS and the other one called SOO. So could you maybe describe what those are real quick?
So IRIS is the Integrated Resourcing and Incentive System, and that was kind of developed in Army MEDCOM, like I said, about 2013-14 in that fiscal year, in order to proactively fund our budgets at the MTFs based on the performance plans that were submitted by the MTF commanders. So it was really a way to harness and gain MTF commander buy-in on the budgets, because they developed the business plan, and if you execute this business plan, we're giving you the money up front in order to execute the business plan. So it tied in the business plan, it kept track of your productivity in specific service lines, and then we pushed and pulled money back and forth whether or not you met your business plan or not. And then we had some incentives on the side, to incent behavior in different ways. We'd give, 50 cents if you put a BMI in when you went to your primary care clinic and you calculated the BMI correctly. So that was the incentive system, was kind of how to incent people's behavior. If we saw something not moving in the right direction, we could incent some behavior and give some monetary incentives. So that, in a nutshell, is the integrated resourcing and incentive system. And the statement of operations, that was the first time that we did the budgets on a piece of paper that at the bottom right-hand corner had a signature block space for the commander to sign for their budget. And so it gave the workload targets for the MTFs, and then it gave how much money you were getting in order to meet those workload targets. It gave it at the beginning of the year before 1 October, the MTFs had their budgets.
That's very interesting, and I think what's great about that, it's using a lot of the tools and methodologies of private sector to be able to control some of these costs and also workload for these hospitals. My final question, ma'am, I'm sure some of the readership out there is going to ask me hey, what's the difference between MEDCOM and DHA?
Oh, that's a loaded question. So if you had asked me 2 years ago, it would be different than a year ago and different than today. But so NDAA 17, right, the Congress directed that DHA would gain authority, direction, and control of the MTFs. So it took several years, painstaking analysis and work and integration and agreements to essentially split some of the work that we were all doing in this at the same time and split it and say, this is generally healthcare delivery and this is medical readiness. And I think it would be, our jobs would be easy if everything was black and white, but we all know there's it's a big Venn diagram with a lot of gray in the middle. So we do overlap a lot with readiness that is also funded in the DHP delivery of care. So the Army MEDCOM took the medical readiness pure functions, and DHA took the healthcare benefit functions, and then the ones that are in the middle, kind of the gray area, we work together to make sure that on the policy side for MEDCOM and the execution side for DHA, that we all make sure that medical readiness is our #1 priority.
Well, thank you, ma'am, for joining us today. And I appreciate your thoughts on, in medicine. And lastly, I just want to thank everybody. If there's any junior careerists that want to, again, be part of this podcast, or if you're a senior careerist, please let me know. Again, this is sponsored by Bourbon and Biz, and I'm Jamie Hansen. Thanks.